Welcome to Healthcare Assessment, a proposed service that will be available under the Level 1 Self and Individual Options Waivers. Presented by the Ohio Department of Developmental Disabilities, Medicaid Development, and Administration's Waiver Policy Technical Assistance Unit. The purpose of this presentation is to review Ohio Administrative Code Draft Rule 5123-9-27, Healthcare Assessment under the Level 1 Self and Individual Options Waivers. Healthcare Assessment is a proposed new waiver service available on July 1, 2024. What is Healthcare Assessment, HCA? Healthcare Assessment uses technology to provide real-time health assessments to determine the best clinical course of action. It often avoids unnecessary emergency room visits and decreases the need for inpatient hospital admissions. Healthcare Assessment does not replace the services provided by a person's primary care physician, and unlike other waiver services, Healthcare Assessment is provided as a monthly subscription. Why is the Healthcare Assessment service being proposed to be added to DODD's waivers? DODD had a pilot program called the Station MD Pilot Program that began in February 2022 and is scheduled to end on June 30, 2024. The program provided real-time assessments for people, much like what was described on the previous slide. The Station MD pilot program was limited to 5,000 people. Those who participated in the program found that it helped them avoid unnecessary trips to the ER. The Station MD doctor helped to determine what course of action the person or their staff needed to take. When a person did need emergency department services, Station MD staff coordinated with ER staff so they were better prepared to treat the person. They also followed up with the person after the visit. People and their caregivers felt empowered to better meet their medical care needs. Ohio, like other states, recognized the benefits of Station MD. 87% of the Station MD pilot survey respondents felt they had overall improved health outcomes. The Healthcare Assessment Service will allow a person to receive the same benefits observed in the Station MD pilot program, but as a monthly subscription service that is paid through a person's waiver budget. Per OAC 5123-9-27, Healthcare Assessment, HCA, means using technology to facilitate real-time consultation and support provided by a physician assistant, or an advanced practice nurse to assist an individual or their authorized caregivers to understand the individual's presenting health symptoms and identify appropriate next steps. Healthcare Assessment is consultative in nature, reflects the presentations and treatments unique to individuals with developmental disabilities, and provides disability-specific guidance on when best to seek additional, or in-person, medical treatment. It includes support and consultation based on expertise in developmental disabilities to an individual or their caregivers and seeks to empower the individual and build the capacity of caregivers to better understand the best approach for supporting the individual based on their symptom presentation. When the provider of healthcare assessment recommends an individual go to the emergency room, urgent care, or primary care physician, this service includes clinical transition of care conducted immediately after conclusion of the consultation from the provider of healthcare assessment to the receiving provider to help guide care and provider coordination. Healthcare assessment includes follow-up consultation as needed with the person and their caregiver within 18 hours of the initial consultation. The Healthcare Assessment Waiver Service does not duplicate or replace other home and community-based services or medical services available to an individual through the Medicaid state plan, such as the Early and Periodic Screening Diagnostic and Treatment EPSDT benefit, or in-person examinations as needed. The Healthcare Assessment Service will allow a person to receive the same benefits observed in the Station MD pilot program, but as a monthly subscription service that is paid through a person's waiver budget. The Healthcare Assessment Waiver Service is provided on a one-to-one basis. It requires a face-to-face evaluation by a treating physician, physician assistant, or advanced practice nurse. The provider directly engages with the person during the evaluation. Healthcare assessment can only be provided by an agency provider that has a Medicaid provider agreement with the Ohio Department of Medicaid. Applicants to be providers of healthcare assessment must provide documentation of at least 4 years' experience providing medical care to individuals with developmental disabilities, their ability to address and triage the medical needs of individuals with developmental disabilities, and the achievement of positive outcomes, such as reducing emergency room visits or individual satisfaction with the services they received. The person employed by an agency providing healthcare assessment can be a physician, physician's assistant, or an advanced practice nurse who is properly credentialed and in good standing. Before delivering healthcare assessment, the provider must complete 25 hours of training specifically related to individuals with developmental disabilities. A person must have an assessed need and will need to be enrolled with the DoD certified provider they choose for the healthcare assessment waiver service. While it is a team planning decision, authorization is based on the individual's assessed need. Access to a mobile smart device or webcam that has internet service and is capable of two-way audio and video communication is needed. The person or their caregiver must be able to operate the device. Team planning conversations may need to include authorization of the assistive technology waiver service when a person has an assessed need for healthcare assessment but does not have access to a necessary device, or if the person requires training to use the device. Healthcare assessment must be authorized in the individual service plan. It is a monthly subscription service that is authorized and billed as one unit each calendar month. Although a person does not need to receive an evaluation or consultation each month, this service is authorized. They must be available to receive the service at least one day during the calendar month. If a person is admitted to a hospital, nursing facility, or in an ICF for respite for the entire month, they cannot receive the healthcare assessment waiver service that month. A healthcare assessment provider must be available 24 hours per day, 365 days per year. They need to be able to participate in live two-way audio and video interactions with the person and their caregiver to provide immediate evaluations, examinations, and develop plans of care that are completed by professionals with extensive experience supporting individuals with developmental disabilities. And the persons providing healthcare assessment must be in a location that guarantees the individual's privacy. Communication with the individuals and caregivers must be secure and comply with state and federal regulations governing healthcare assessment services, technology, and privacy, including the Health Insurance Portability and Accountability Act. Healthcare assessment providers must follow up with the person within 18 hours for each call that involves an individual being attended by a physician, physician assistant, or advanced practice nurse. And when a person is referred to an emergency room, urgent care, or primary care physician, the healthcare assessment provider must contact the emergency room, urgent care, or primary care physician to coordinate care and ensure advanced preparation. Thank you for viewing healthcare assessment under the Level 1, Self, and Individual Options waivers. If you have questions about authorizing this service, please contact Waiver Policy TA at dotd.ohio.gov.